Hello, so this is chapter 22, Substance Use Disorder and the Older Adult. Scope of the problem. By 2029, 20% of the U.S. population will be over 65. By 2050, there will be a global increase of 1 billion adults in this age group. About 2% of U.S. adults over 50 years of age use an illicit drug in the last year. Alcohol is the most commonly misused drug. 15% of those who drink have a concurrent SUD. Marijuana use is an ongoing problem that can exacerbate other health issues. Over half of the men and 1/3 of women aged 60 and older use alcohol, which can complicate the use of over-the-counter and prescription medications. What are the consequences of an SUD in the older adult? Older adults take 1/3 of prescription and 1/2 of over-the-counter medication sold in the United States yearly. Misusing these drugs or alcohol can exacerbate mental health problems. Drug use is associated with vitamin absorption problems that are related to dementia/pseudo-dementia. Depression is a major issue for the elderly, related to suicide, which also reveals a problematic influence of alcohol, used to lower inhibitions prior to a suicide attempt. Why is the detection of SUDs in older adults so difficult? No screening tools developed specifically for the elderly, but existing screening tools do have some value. SBIRT and BRITE, BRITE. Greater number of expected normal/normal medical problems can mask problematic substance use patterns. Social isolation allows for closet drinking or drug use, absence from work or social events often dismissed due to age. Alcohol misuse in older adults falls along a continuum: abstainer, social drinker, at-risk drinker, abusive drinker, dependent drinker. Majority of older adults fall in the first category. Another classification system distinguishes between late-onset alcoholism, late-onset exasperation, and early-onset alcoholism. Prescription drug misuse. Almost 20% of older adults may take prescription medications that were not prescribed to them. Such misuse takes several forms: mixing alcohol and prescriptions, intentional overuse of prescription, intentional underuse of prescriptions, erratic use of prescriptions, failure of physician to get complete history. About 12% of older adults take benzodiazepines, which can have unintended effects and consequences. The treatment of older patients with SUDs. Special needs of individuals are as follows: primary prevention, outreach, detoxification, protective environments, primary treatment, aftercare. Managed care makes it unlikely that comprehensive programs will be developed. Adults over 80. They are considered the oldest of the old. They are at highest risk for depression, other mental health issues, and suicide. Various medications that would be routinely prescribed for younger adults warrant special consideration for those over 80, like aspirin. So that's it for this video. Thank you for listening.